Rusi, and I'm with Trine University, and today I'll be talking about the Joint Commission and the Indiana State Department of Health. So what I'd like to talk about first is the mission and vision of the Joint Commission, and these are straight off the website. So the mission is to continuously improve the healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. And then their vision is all people always experience the safest, highest quality, best value care across all settings. And later we're going to compare that with the Indiana State Department of Health. So a little bit of history on the Joint Commission. It was founded in 1951. It's the nation's oldest and largest standard setting and accrediting body in healthcare. I think that speaks volumes of the quality of work that they do. It evaluates 21,000 healthcare organizations and is non-mandatory. So you do not have to do this. It does cost money, but it kind of really puts you above the rest. And then to receive and keep the Joint Commission's gold seal of approval, the organization must go through a survey every 3 years, and for laboratories it's every 2. So for the first day that they're there, it's going to cost a certain amount of money, and then the day after it's lower, but it's still going to cost you a pretty good amount of money to be able to get the gold seal of approval. So the macroeconomic effects of the Joint Commission. So it increases the community's confidence in you. So if a patient had to go to your place and you are gold seal of approval from the Joint Commission, or they're going to go to a different one, they're going to want to go to you because they know that that standard of care is there. And then it may reduce liability insurance costs as a whole organization, and then provides deeming authority for Medicare certification, and it gives you a competitive edge above the rest. So the microeconomic effect of the Joint Commission is broken down into 3 different categories. So financial planning, it provides education on how to improve your business operations. So it kind of gives you a breakdown of how you should budget, and then it reduces liability insurance costs as well. So that's in both macro and micro because it affects your day-to-day as well as the overall picture. And then management decision making. An organization must be accredited by an independent accrediting organization in order to provide Medicare beneficiaries durable medical equipment. So as a manager and as kind of that higher up, you need to make the decision if getting the Joint Commission's approval is worth it or not. And in this case, it really would be to benefit your patients. And it also enhances staff recruitment because they know that quality of care is there and they want to be a part of that quality of care. And then policy and procedure development. So national safety goals need to be met. So policies for physical therapists will be in place. So example, asking a patient their name and date of birth, or the 2 identifiers that you need to ask them, just to make sure that you are treating the right patient and not treating a leg instead of an arm. So the Indiana State Department of Health, their mission is to promote, protect, and improve the health and safety of all Hoosiers. And the vision is a healthier and safety Indiana. These are a little bit more broad than the Joint Commission, but they essentially want to do the same thing as improve healthcare and make it that quality that people really deserve. Okay, and then the Indiana State Department of Health has these core values. I'm not going to really go over them, but they're what they kind of uphold when they are evaluating and what they want to strive to be. So a little bit of history. It originally started as just registering births and deaths, and then it kind of went over to licensing several healthcare facilities and making sure they're up to code. And they also keep records of immunizations, diseases, and marriage and births, and death certificates. And with marriage and the death certificates and everything, they kind of break that down within demographics of different populations, so you can just see the different kinds of people that's affected. And then the macroeconomic effect of the Indiana State Department of Health. So providers of PT are not licensed. However, the person who is giving the physical therapy needs to be licensed. So I thought that was kind of interesting. And And then the ISDH is responsible for monitoring the quality and making sure Hoosiers are available to receive that quality of care. And then the ISDH is available to direct patients where they need to receive therapy. So you can go on their website and look up where you need to, or what county you're in, and then I'll show you what's available to you for physical therapy. And then the microeconomic effect of the Indiana State Department of Health. So financial planning. So in order to be reimbursed by Medicare for physical therapy services, a physical therapist must be in a private or a group practice that is certified by Medicare or certified by an accrediting body. And then management and decision making. So an administrator must be full-time. So if you're a manager of a physician, like a clinic, you need to be able to be full-time and be there and not be at other places. So you can only be at only one Medicare certified organization. And there must always be an alternate, and that can't be the same person. And then policy and procedures development, so safety regulations, so making sure your exit signs are lit up or where they're supposed to be, or your alarms are set in place and they're checked and they're up to code. So, and these are my references, and if you have any questions about the Joint Commission or Indiana State Department of Health, feel free to ask.